Hello, my name is Penny Meadows, speaking on behalf of the Thurrock CCG and St Luke's Hospice around a new project I'm leading on called It's Time to Talk. I hope to host a series of podcasts focusing on access to end-of-life care services for people with a learning disability, raising the profile of their needs and helping their families. Our aim and passion is to improve the quality of support and access to palliative and end-of-life care services. Here at St Luke's Hospice, we are a charity providing compassionate care to people whose illnesses are no longer curable. We promote dignity in dying and empowering people to make choices that they want from the moment they are diagnosed. For more information, just give us a call on 01268 524 973 or visit our website on www.stlukeshospice.com. Today's podcast is with our resident doctor here at St Luke's Hospice, Dr Jonathan Ashworth. Hello, Doctor.
Hi.
Please can you explain your role within St Luke's Hospice?
Thanks, Penny. So I'm the palliative medicine consultant who covers our inpatient unit here at the hospice. I also support our outpatient services and our care home support team. So for our inpatients, I'm responsible for their medical care whilst in the hospice, and that includes assessing the patients and making an individualised plan for them for their ongoing care. I provide the medical support to our multidisciplinary team, which aims to give them the best possible care for the individual and support their needs.
Can you tell me a little bit about end-of-life care within the inpatient unit, also how you get referred into and what you can offer?
Yeah, sure. So our patients may be admitted for their symptoms to be assessed and managed. Other patients may have a short stay for respite, and others will be coming into the hospice because they've reached the end of their life and they wish to spend their last few days with us. Patients are often referred for an admission to the hospice after being assessed by one of our community teams or from the hospital. People may be referred in by their GP, a district nurse, or another nurse specialist in the community. For patients that are admitted, they have a full assessment of their needs, including their physical, psychological, social or spiritual, and I would review their medications to ensure that their symptoms are as well controlled as is possible. Apart from the doctors and nurses who work in the inpatient unit, there are other members of the team with their own specialist skills, and that includes counsellors, chaplaincy team, physiotherapists, complementary therapists. We also have a creative therapist and family support worker. We work together as a team, and we try to aim to provide the best possible care for those patients and their loved ones. We look after each person as an individual, and we address their personal needs. And that's achieved through working closely with the patient, their families, every step of the way. So it's important for people to feel guided, supported, and involved in decision making, and I'm there to provide that medical guidance.
Thank you. I think you've answered the next question, really, but it's just about how we can help someone with a learning disability and how we can support the family members or their loved ones. Are there any reasonable adjustments?
So people with learning disabilities have the same palliative care needs as the general population, and that includes symptom management, for people to try and come to terms with their illness and dying and making decisions about their wishes. They may also have additional needs due to their disability. For some people with learning disabilities, they might find it more difficult to access healthcare, but it's important that every person gets a fair access to the medical care that they need. People, prior to being admitted to the hospice, it might be possible for them to be shown around the hospice, and that might help before admission to help reduce the anxiety about their admission. Sometimes patients will already be known to our outpatient service, and therefore they might be more comfortable coming into the hospice as they already know many of us who work here. Some patients will have hospital passports, which is a booklet which includes details about the person's likes, dislikes, how best to communicate with the person, and there's various ones of these. One commonly used is the All Around Me document. And once admitted to the hospice, it's important for every patient to be treated as an individual. And it takes time for us to get to know what is important to them, and it's important for them to have close involvement of the family, their friends, professional carers, and those that really know the patient the best. Many people will also be known to a learning disability liaison nurse, who we would work closely as part of their care team. It's often beneficial for those close to the person being continuously and heavily involved in their ongoing care, and that's particularly important as we get to know that person and as they get to know us. And that might include them coming in and having one-to-one support during their stay in the hospice. We recognise that many people with learning disabilities will have communication difficulties and may find it harder to express their symptoms or wishes, and they may communicate in different ways, and it will take time to learn about how their individual expresses themselves. And this often involves family members or carers who have known them for long periods of time. Providing them with the best centred care involves addressing these needs and challenges, and it's important that we adapt our communication styles to that of the person. This may involve using picture boards, sign language, Makaton, or Easy Read, for example. We've got access to these within the hospice. For all patients, it's important for them to be at the heart of any decision making, and we would therefore involve all those that are important to them with decision making. We find it often important to have honest discussions with the person as they're approaching the end of their life in a way that's meaningful for them. And most people with learning disability will cope with things, we find, better if they understand kind of what's going on. Understanding about their illness can sometimes reduce the fear of the unknown. It's important that when having difficult communications and difficult conversations with them, that they're in surroundings where they feel safe and comfortable, and with those close to them, such as their carers and family, to be present really to support them. And it's important for them to know that it's okay to feel sad and that they're not alone in these feelings.
Lovely. I think you've actually said that everyone is individual, so that's really good. If anyone with LD requires support from St Luke's, can they be supported at home, and what services are there to support them and their families?
Well, there's a variety of teams who work for the hospice to provide support for patients at home. I mean, the majority of our patients are in the community, and it's important that they have access to all the same services of the MDT that our inpatients are able to receive. So we have a consultant-led team, including specialist nurses who review people's symptoms, such as their pain, nausea, constipation, and really try and help manage these symptoms at home to the best that we can. We have a hospice at home team, and they can review the person's care needs. They can arrange planned respite in the home or allow a carer to have a much needed break. And through their work with Marie Curie Cancer Care, then night support can sometimes be provided, where the nurse would support them throughout the night so the carer gets a good night's sleep. And they provide weekly telephone phone calls to support the patient and their family as needed. The hospice at home care team that we have as well will offer social care services for people who need care and have a life-limiting diagnosis, for those patients whose condition is rapidly deteriorating and those that are not expected to live more than 3 months. And the majority of these care packages that can be put in are commissioned through our continuing healthcare funding. So in addition to this, we have a carer support worker who can discuss practical support and advice, as well as training to help carers in their role. And we have support groups that are also run by the hospice. So many other members of the MDT, such as the counsellors, our physiotherapists, occupational therapists and others, they help support the patients and their loved ones at home. And of course, more information is available on the St Luke's website, which is at www.stlukeshospice.com.
Thank you for that. And the other thing I wanted to ask was, could you explain a little bit, I know you explained about the services, but one response service, what that can offer at home?
Yeah, So I didn't mention the One Response service before, but the One Response service is a 24 hours a day, 7 days a week coordinating service, and they offer support and advice to people with palliative care needs or need care at the end of their life. And this is for anyone over the age of 16 who live in southwest Essex, including Basden, Wickford, Billericay, Thurrock and Brentwood. And it's a central point of communication for patients and their carers, as well as family members and professionals. So it's staffed by qualified professionals, including clinical nurse specialists and registered palliative care nurses, as well as end-of-life care facilitators and other trained call assistants. So calls are responded to with empathy and friendliness to really provide that advice and support.
As a doctor, in your experience, have you been involved in caring for a person with LD as a patient, a family, or a friend?
Yeah, so I've noticed that some of the patients, particularly recently, that we've looked after with learning disabilities have been diagnosed late with their cancer. This may be due to fear or difficulties in accessing the healthcare that they need. But I think that the COVID pandemic has made the issue worse due to increased anxiety in contacting their doctor. And with fewer face-to-face appointments, people with communication difficulties may find it harder to express their symptoms. So people with learning disabilities are more likely to be vulnerable and isolated as well. And the pandemic has made this even more of an issue. Therefore, it's a good timing really for us to increase awareness to help those that need it to get the support that they deserve.
Some of the feedback we get is the whole family has felt supported and looked after when someone is admitted into St Luke's inpatient unit. Do you feel that is the case?
Yes. Everyone who works at the hospice shares the same aim to ensure that those people, regardless of their condition or situation, get the best possible care. And this can only be achieved through having an individualised approach and coming together as a team, using everyone's skills to provide that management. For a lot of people with incurable life-threatening conditions, things can feel overwhelming and frightening, and they need somebody to listen, care and guide them through very, very challenging times. And as a hospice, it's vital that we are there to provide that support for the patient and their loved ones.
Thank you. I think you've answered the last question really. It was just about what's important to consider when caring for someone with a learning disability who's approaching end of life. But I think you've answered all the questions really, that everyone is individual and everyone is treated as an individual, which is what people would like. I'd like to thank you for being our guest speaker for this podcast. And thank everyone else for listening today. And please tune in again for one of our other podcasts. Thank you. Thank you, Dr. Jonathan.